subscription librarian for NC Live. And this is our third and final webinar in our month-long community empowerment series. This webinar is empowering libraries to connect with aging patrons, and it will be led by Joseph Winbury here. He is an assistant professor at UNC Chapel Hill School of Library and Information Science and is a recent IMLS grant awardee who has done extensive research on how aging patrons interact with libraries. He will share his research, some recommendations, and some statewide and local resources for this topic. So I will have Joseph take it away.
Wonderful. Thank you, Devin. And hello, everyone. Thank you for being here on such a, at least where I am in North Carolina, in Chapel Hill, it is a dreary day here. So appreciate you all the more spending some time. So let's see. Okay, great. And I'm guessing you can see that all right?
Yep, all good.
Okay, wonderful. So got to do all the obligatory checks with the Zoom on that. But again, thank you all. So with my apologies to Devin, because when we were working on this, I didn't quite get the title that I was thinking of. I didn't quite get it down. But it's kind of an evolving idea. But this is sort of my ethos for the presentation: librarians serving older adults, lessons from research and practice. And so some of the you can see here I like to give sort of an outline of what we'll be talking about. So we're going to start with a little bit of background, and then I'm going to spend some time talking about 3 of my research projects and some of the findings ultimately as recommendations that I think might be valuable for you all. And I'm also going to talk about some of the resources that are available in North Carolina, and so around aging. And I recognize that there are some folks on the call who are not from North Carolina, but I think some of what I was going to say will be beneficial also, some of the federal mentions and things, and then we'll have time for Q&A and discussion. I will say, though, the folks that are here from elsewhere, you ruined like the one good joke I had, which was to say that the North Carolina librarians are my favorite. And it's a little bit awkward with other people. So you all for the day are all North Carolina librarians. So thank you all for being here, and looking forward to spending some time with you. So first, starting with some background here. So if you are someone who is really into numbers, you can see here that over the next several decades, the population of who is an older person, or the number of older people in the United States, is going to increase considerably. And so we're talking about people who are 65 years and older, and they are already the fastest growing population in the US and around the world in many countries. And people 85 and older are especially fast growing within that group. And this is kind of against the backdrop of some real demographic changes that are occurring around the world. So the United Nations found in 2018, for the first time, people 65 and older outnumbered those 5 and younger. And when I say for the first time, I mean the first time in recorded history. So we're talking about some real interesting changes that we're going through at this time. And the big takeaway I have of this right away, right, is we all understand how numbers work in the sense we recognize that the needs of older people are going to increasingly become an important part of the work that we do. And so it's important for us to think more on their needs and how we can best serve them. And one of the things I also wanted to show in relation to this is this map of North Carolina from the NC Medicine Journal. And what you can see here are all the countries, all the counties with people who are 65 years and older, where there are more of those folks, and the counties where there are more people aged 0 to 17. So that statistic from the United Nations in 2018, you can start to see where some of that is really playing out in North Carolina, and it's in most of our counties. So that's going to be something that's going to affect all the work that we do as librarians, and this population is going to become more of those we serve and their families, and that is something that is very important. But beyond just the numbers game, there are other reasons why it's very important to meet the needs of older adults, and that is elder justice. So if you are familiar at all with terms like social justice, equity, essentially what we're talking about here is how can we ensure that there are equitable resources between and services for older adults in comparison to other age groups. And this is something that is important for a number of reasons. One of the big issues that older adults can certainly face is ageism. And this is stigma or discrimination against someone because they are older. And ageism, right, can also be experienced by younger people. Research shows that women as young as 35 experience ageism in the workplace. So ageism is something that people of many different ages can experience. But in relations to older adults, we recognize that youth is often privileged in society. We see this in media, we see this in entertainment, we see this certainly in the Hallmark card aisle. There's a lot of attention on younger people and the discussion of being older as a bad thing, rather than how I see it as a good thing and a reality of life if you're lucky. And a lot of older people report feeling invisible in society. So we have to really consider ageism and the impact that it has. And one of the impacts that I believe in research is backed up to show that ageism helps promote is elder abuse. And so elder abuse is harm that might be physical, emotional, financial, sexual, psychological, that is being perpetrated against someone because of hatred or perceived vulnerability due to age. And so studies indicate that about 1 in 10 people, 60 and older, have experienced some form of elder abuse. So this is really, if you think about 1 in 10 people 65 years and older or 60 and older and how big a group that is and how fast a growing a group that is, you recognize just how impactful elder abuse can be. And as someone who has worked as a practitioner in the elder abuse area and trying to respond, and when I was working at the Knox County Office on Aging, showing some of these really difficult case studies to police who were receiving training at our office, hearing some of those local stories happen just really hits home the importance of recognizing that elder abuse does happen and that it's part of the need for justice for older adults. But I also want to talk about intersectional discrimination, the reality that we are all sort of made up of different components that make up our full identity. For me, I am a man. I am also someone who is white. I'm also a professor. I'm also gay. So there's a lot of these identities, some of which bring, I think, privilege in our society, and some of which have experienced more marginalization. So when we're thinking about older people, right, we know that like any other group, older people is a diverse population. And so it is possible that older adults will experience intersectional discrimination because they are both older and a member of another marginalized group. Things like ageism, ableism, homophobia, transphobia, xenophobia for immigrants and things like that. So there's a lot of different ways. This is also called double jeopardy in the gerontology research, recognizing that there are challenges older people experience and other aspects of their identity may also bring challenges. So for all these reasons, I find that it's really important to think about the needs of this population, not just as a numbers game, but a reality that we, all of us, right, want ourselves to be able to live life with dignity and respect. And I think everyone on this call wants that for other people in society, and older adults are a population that we can do that for and work on that, and oftentimes don't get enough attention in that way. So that's important to recognize. So now I'm going to talk through 3 of my different research projects that I think hold important information for our work here. And the first one is the Ivory Towers Gray Library, evaluating services for older adult students in academic libraries. So who might be an older student in an academic library or an academic institution? There's really 3 main areas that I have seen in the literature. One of that is personal gratification in retirement. Folks that are retired, they're not looking to go back to work, but they want to learn as a form of intellectual stimulation and entertainment. And so they might take a class at a college, even multiple classes, or even sometimes a degree just to get more learning in that way. There also are folks who are wanting to make a career change. Librarianship is really shown to be one of those careers that for many people, they've worked a separate career, and then they might go back and get the Master's of Library and Information Science if they want to go that route and become a librarian. That degree is often required, so that might be an example. So there are folks in academic libraries who are making their own career changes. But we also know that there are economic necessities that come into play. With the cost of living, people like the financial advisor, Susie Orman, is saying that people should try to work until they're 70 and put more money away. But we recognize that even if you are willing and able to keep working, there are sometimes things that keep you from doing that. If you were laid off in your 50s or early 60s and you want to go back into the workplace, there are a lot of studies that show that there is ageism towards older folks sometimes on the job market. So that can be an issue. So we as librarians, right, we can't fix every one of these major problems, but we can do things that can contribute to a positive effort and try to make some changes. And so in doing this work, my research partner and I, we came up with this question: how are older adults represented in academic library websites? And the reason that we did that is we could have interviewed older adults who are using academic libraries or librarians who are working in them. But what we decided was, just for a cost-effective way, we look at websites. But also, I think many of us recognize that websites are a sort of window into the world nowadays. With reference interviews going down, a lot of people are going to websites and doing searches for themselves and looking for information. And sometimes if they can't easily find that, they might just assume that it's not there and not look any further or ask for help. So we felt that looking at these websites and seeing how our older adult students represented would be something important to do. And so here are just some of our methods that we use. We did a content analysis of the 25 land-grant universities with the highest number of students 50 and older. We did a content analysis of their academic library website. And we used, at the time, which was the newest IPED data from the Department of Education. And we considered things like information sources, the information policies, and external and internal connections. And some of what all that means will make sense as we go along here. So here are the overarching themes: broad inclusion, community engagement, and older adult representation. And I'll break down each of these. So the first theme from our research we found was broad inclusion. And so as expected, all of these institutions had some collections related to older adults. Several of them even had resources for older adult students in particular. But very few of these institutions spotlit the collections on older adults. So, we know if someone is thinking about their identity in a very particular way, they might go and do a search and think, I'm an older student and I'm interested in learning more about that. But for oftentimes, if you might not be looking for things, but we all know the importance and the power of serendipity. And when you are walking through the library and you see a display, or you're just sort of browsing through the website and you see something there that the staff has decided to put forth, that's something that's really important. And by staff, of course, we're talking about people who are degreed librarians, but many folks who hold librarian positions don't always have that master's degree. So and there are other library assistants and folks that are doing this work. So that's important to recognize too. So that we are seeing sometimes those collections are not being spotlit. Also, we saw that there are some of these academic libraries that do have their own diversity committee, or they participate in a university-wide diversity committee. And the University of Missouri, for instance, they had they've talked about age in particular in their diversity statement, but oftentimes there was no identification of any sort of purposeful representation around age in diversity committees. And so the second theme I want to talk about is community engagement. And so there were several examples that of internal and external audiences engaging around the aging issues. And so I want to note here, I have some images. These are not related to the data itself. I actually got these from an age-positive media library that is based out of the UK, but really has a lot of images that I think represent very well the American experience. And I do have the link to this in the references if anyone is interested in looking more at that. But some of the particular programs that they saw, the University of Minnesota's biomedical library, for instance, they had a health literacy programming, and it hosted a panel on libraries and health, and that had a representative talking about how can these academic libraries serve the information needs of older adults around health. And there also were a lot of health information reference, having folks who are not part of the academic library, but are part of the community coming in and talking with the academic librarians who have a wealth of information and knowledge around health issues. And so those sorts were examples that we could see how the academic libraries and the land-grant institutions are really taking on their role as essential community-based institutions, trying to meet the needs that exist for the particular community that they are in. And so a third theme that was really important was older adult representation. So we found that there was oftentimes representation of older adults as people who were being cared for. There was discussion like the University of Florida had an example of how do you work with older adults if you're a nurse, for instance, on some of their library guide websites. And that, of course, is very important for students. But there were also some resources for older adults being represented as students themselves rather as patients. Texas A&M had a LibGuide talking about education for older adults. And Purdue University talked about social justice and diversity amongst older adults. So all this representation reminds us that older adults are a very diverse group like any other group, and they certainly can be patients that students might work with, but they might also be students themselves. They might also be people who are a member of a marginalized population or a population that's not marginalized. So we really want to recognize the diversity that exists among older adults and respect the complexity that comes with those identities. Okay, so that was the first project, major findings, and I'll talk about some recommendations for it as we move along here. But the second project that I want to talk about is finding new ways to support social connections for older adults. Rural public libraries innovate during the pandemic. And if you have any questions as we go, feel free to put those in the chat so you don't forget, and we'll talk about those at the end. But this is not news to anyone on this call or really anyone around, but COVID-19, of course, brought major risks to everyone and additional risks to older adults. And in addition to the health risks, there were additional challenges to older adult well-being during the pandemic, including social isolation. And those who did not have the digital access or the digital skills to join the rest of us in the Zoom, the kind of the Zoom room in the sky for everything, they really suffered in many ways during the pandemic. And that did include many older adults, though certainly not all older adults. But another important thing to recognize is that in many rural communities, there may not be a senior center for older people. So a lot of these communities, the library either serves as the de facto senior center or augments what else might be available for folks. And that's something, so it serves a very important purpose. And so when we were looking at this, the question that we asked is, how do rural and small libraries innovate to better serve older patrons during the pandemic? So we recognize that oftentimes these libraries don't have the same tax base to offer as many services, and they serve different populations sometimes than other types of libraries. And so in order to understand this, we looked at the qualitative responses of a survey. And in order to send out the survey, we did a sample from an IMLS fiscal year 2018 public library survey. And we used a cluster sampling of that. And we analyzed responses from 173 librarians in the sampled rural and public libraries. And so it turns out that there was actually a great deal of innovation going on at these libraries during the COVID-19 pandemic. And innovation is something, right, that, what is innovative for one library may not be innovative for another. But just to kind of give you some of the examples that we saw, one of those was creating and hosting a website for a community response group. So in some of these communities, the public library was literally the center of the response in the community to the pandemic. They brought together not only the library, but also the public sector, other elements of the government, nonprofits, and for-profit entities together, putting all this information in one source that people could go to get what they needed around serving, getting their needs met for COVID-19 and finding resources and things like that. They also, in many cases, either created or extended existing partnership with aging services providers. And aging services providers are things like maybe you've heard of the Area Agency on Aging or the Office on Aging, and things like Meals on Wheels. These are just some of, or senior centers, some of the iterations that exist of aging services providers. So we saw a lot of them working more handedly with those folks during the pandemic. And they also did a lot of expanded online programming. There was, not just bringing people together online in a visual way, which was in and of itself important, but also thinking about, how can we, are there games, are there things that we can do that kind of stretch our own understanding of what we could do online to bring people together? And for me, probably the one that stood out the most as being the most impactful was what we call the check-in calls. And a few different providers, actually, I think a good number of them talked about this, where in some cases there were some older patrons at the library who they would see very often. And when COVID happened and people couldn't come to the library, one of the things that librarians did is they proactively reached out to these individuals and checked in on them with sort of a moral support. How are you doing? But also connecting them with resources, using their librarian skills in that way. And some of the respondents really talked about beautiful stories of when it was deemed safe for people to come back to the library. They would have these reunions where the older adult and the librarian would come together, sometimes hug or embrace, and cry with one another out of recognition of the challenging times, but also the gratitude of maintaining that connection. And what I love so much about that example is librarians do a great deal of work, and they're very good at quantifying and talking about that work, and that is meaningful and important. What is also meaningful is, and harder to quantify, is that human connection, and just showing how libraries and librarians in particular really seep into every aspect of the community and do what they can to make a difference. And it's very important that we recognize that. So the third project that I want to talk about is my dissertation research. And the title is People Have Died to Get Us to Where We Are, Combating Aging Services Information Marginalization Alongside LGBT Older Adults. And if anyone here is familiar with the PhD process and writing a dissertation, you recognize the unwritten rule, which is if you can say the whole title without nearly passing out, you're doing it wrong. And I did get a little lightheaded, so I think my title's actually in pretty good shape. So, but there's a lot to unpack about what does this mean, and so let's talk about it some more. So one of the first key elements of the title is information marginalization. And this is a concept that was originated by Gibson and Martin in 2019. And essentially what they're talking about information marginalization, they're recognizing that there are systemic barriers that folks who are a member of a marginalized group experience in many areas of their life. And one of those areas is around the needs of information. Getting their information needs met can be very difficult. And oftentimes when we think about information literacy in our field, we're putting the burden of information literacy at the feet of the individual who is experiencing it. But we don't oftentimes do enough reflection on the institutions that exist in our society and how are they making it difficult for certain folks to get the information that they need, and how may they change to make it easier for folks. And so if we are thinking about the context of lesbian, gay, bisexual, or transgender plus person and someone who is not a member of that community, both of these folks, let's just for the sake of ease, think about two men, one straight, one gay, both 80 years old, both married, both deciding with their spouse that it is now a good time for them to go into a long-term care facility. And in a situation like that, there are a lot of things that everyone would like to know, right? You want to go to a safe facility. You want to go to some place that's going to be clean. You want to go to a place that has good staff. But there are additional metrics that certain groups may have. And so if you're an older LGBT person, there are questions like, are the staff trained to work with older adults? Are they going to treat me and my spouse with respect? Will other people who live there treat my spouse and I with respect? And oftentimes this sort of information is what is least readily available. So if you go to the website, there's a very good chance you're not going to find information about any of those things. And so it creates additional barriers. This couple now has to decide, do I out myself to this facility to try to even just talk to them about living there and what that might look like? And that's just really one example of the information marginalization that might be experienced. And some of our institutions are recognizing that these barriers exist. So for the Older Americans Act, which is the biggest funder of aging services in the United States, it was re-upped in 2020 by the US Congress and signed by the president. And part of the changes that were made to the law around the regulations was for the first time recognizing that LGBT older adults have needs that may be different in certain ways than non-LGBT older adults, and in really requiring institutions to do more, folks that are getting those federal dollars, to do more to meet the needs of that population and to capture what those needs are. And the Older American Act talks explicitly about the role of information in meeting these needs. So that's something, as an information scientist myself, someone with an information background, that really caught my attention. But also, I had some experiences while working at my office on aging that really helped inform my work in this way. One of those, when I was working on elder abuse response, I went to a variety of different groups in our community. And one of those that I went to was a group of older gay men who would meet. And so I went there to talk to them about elder abuse. But what they really wanted to do is they were asking a different question, which is, what is going to happen to me as I get old? And many of these men explained that they had lost jobs because they were gay when they were younger. They had lost family connections. Some relatives, they didn't know if they were living or dead. It had been so long since they talked to them because of disagreements around that person's sexual orientation or gender identity. So, and as a member of the LGBT community myself, and recognizing that the sacrifices that older generations had made so that I could have the life I have today, this really stuck with me and wanted to think more about how we could address these needs. And so what we ended up doing was a community-based participatory research project with LGBT older adults and community organizations like the Pride Center, the Office on Aging, thinking about how can we ensure that LGBT older adults have better access to the information and services that they need. And one of the ways that we did is we did interviews and focus groups with LGBT older adults to come up with a strategic plan that organizations could implement. And the Office on Aging, we have been implementing that now since 2023. We created the Aging Rainbow Coalition, which is the first organization of its kind that we know of in East Tennessee that is trying to specifically meet the needs of LGBT older adults around aging, and that is based out of the Knox County Office on Aging. And as part of doing this work, I wanted to talk to public librarians who were living in East Tennessee to get some of their experiences in working with this population. And so we do have participation on the ARC, Aging Rainbow Coalition Committee, the leadership committee, but the public library did not participate in serving in that committee, but I did hear some responses from some folks. And so some of those responses were things like saying, we do not have that population in our community. That was what a rural library director told me, even though I did know some folks that lived in that community that were members of the LGBT community. Also, a frontline worker saying, I'm in East Tennessee, probably should not share where. My open-mindedness is not shared by the coworkers. And I think we all recognize, right, that it takes a lot of strength for someone to be vulnerable and to come to the library, come to the reference desk. That takes a lot of vulnerability, and people have things like library and anxiety, which can make that difficult for people. So we would hope that any person who is vulnerable enough to come up and ask for help can get the help that they need. So that quote was discouraging in that way. But it was certainly not all bad news. There was a lot of good news, a lot of good responses. One of the responses, someone said, it had not occurred to them that LGBT older adults might have specific needs that we should think about. So they're paying more attention to that intersectionality. So that's something that is really important there. So that work with the Aging Rainbow Coalition continues and trying to do more around information marginalization. And when you get the slides, if you're at all interested, you can go to the link here to learn more about that. But I also just want to talk to you a little bit about another study I'm working on. I got an Institute of Museum and Library Services grant because I did a study a few years back looking at students of Masters of Library and Information Science. And what they said was that they oftentimes had very little representation of older adults in their programs. And so this study is interviewing older adults around the country to help get a sense of what do they want librarians to know about serving older adults, and using that information to be the core of what will eventually be a free and widely available training for students as well as anyone else working especially in public libraries, who want to know more about serving older adults. And it would be open to anyone, but it does focus on a public library setting. So that's an ongoing project, and it's going to take a few years, but very excited about that. And centering the needs of this population. What do they think is most important for librarians to know? Yes. So now we're kind of coming down to the last 10 or so minutes of my presentation here. So take a deep breath. I know there's been a lot of information, and yes, there will be. We definitely will have this recorded, and that will be made available. But now, having kind of gone through some of this research, I want to talk about some of the specific recommendations that I have. So the first recommendation I have is that, well, I want to start by saying I recognize, right, that libraries and library staff have finite resources. You can't do everything that you would like to do, and I recognize and respect that, and I think it's important for us to talk about that more. But if this cause of elder justice is one that has gotten your attention or maybe been on your mind for a while, I'll have some recommendations here of what you can do in your library and beyond to make some positive changes. So one of that thing is creating a plan to better serve this population. And so what we've kind of thought about this as both a bottom-up approach and a top-down approach. So in a bottom-up approach, you might start by going specifically to older adults at your institutions, the people that use your services, and talking to them about, what is working well, what is not working well, and moving on from there into more community engagement, sort of some of the examples we talked about earlier, kind of showcasing how can the library serve the older adult population and their families. And ultimately getting to the place where you go to administration and say, we'd like to create a diversity statement or a report of more information on how we can better serve this population. And in some libraries, it makes more sense to go straight to the providers or go to the administration rather, and talking with them about this, and then doing more community engagement, collecting more data, and then going, to the older adults themselves and saying, hey, we've collected some data. Do any of these changes sort of meet the needs that you see, or are there other things that you can tell us? And both of those can help create a lot of new insights and value. And so on this slide, I just talked about that a little bit more, and so you'll have that in the slide notes. The other recommendation is innovating, recognizing, again, like I said before, that not all two libraries are the same. What is innovative for one might not be innovative for the other. But something that some of the things that came up in our research was some libraries have an older adult librarian position. Not everyone can do that, but there are sometimes some needs that are unique enough between adults in general and older adults that make having this position valuable. So that's something to think about. Doing more outreach to long-term care, homebound organizations, people who are living at home. And this is something that a lot of libraries have done for a long time, but it's not always being offered in the same way. And there might be something you can incorporate more volunteers in to be more robust. Also, while it's important to meet the needs of older adults specifically, it's not always about, that this is a group that should be segregated, that don't have any other connections, because that's certainly not true either. And I encourage intergenerational programming, recognizing bringing people across the lifespan, from children to people who are at midlife, people who are older, all coming together, teenagers, to work on different things. Things like crafts, that could be a sort of thing. And you may already see some of that in some of the programming that you do. But there's also the concept of the living library. Older adults have a lot of experience, in many cases, wisdom that they can share with people that are younger. And building those intergenerational connections are very important. But, I'm someone I'm kind of an emotive individual, if you couldn't tell, a kind of a heart on the sleeves type. And I recognize that not everyone is like that. So one of the things that we can consider too is demographic responsive funding. People like to see numbers. Well, we know that older adults are the fastest growing population. So if it's about serving the growing populations, we should have more dollars serving older adults. That's not that we shouldn't have youth services or that youth services aren't important because they're very important, but serving older adults is important as well, and we should find a way to do both well. And also, we know that artificial intelligence, that's going to be something that's going to be continually changing our society, other technology, seeing how we can use these to improve service to older adults where possible is important, I think, as well. And also here, beyond just within your job or in your community and going to the library board, to the staff, you can think about how we can make larger structural changes around the needs of older adults. And one of these ways may be getting involved in the American Library Association. I think it's really important for people to be engaged in the institutions. Institutions are not perfect because people are in it and people are not perfect, but we are definitely worth it nonetheless. And there are already some existing entities within the American Library Association. There is the Dementia Alzheimer's Interest Group. There's also through the Reference User Services Association, there is Library Services to Aging Population, which is sort of best practices. But a group of us recently got together and created the Elder Justice Task Force. And the idea behind this task force is to recognize the particular social justice needs of this population and try to work in partnership with them to address some of these structural issues where we can within our organizations, in the broader library field, in our own communities. And the Social Responsibilities Roundtable of the American Library Association made the most sense for this because they have been around since the 1960s, fighting on different topics and trying to create more inclusive services for all people. So bringing more attention to the needs of older adults makes sense in general, and especially in this time period where we're seeing a growth in this population. Okay, so now I want to talk a little bit more of the North Carolina focus, talk about the North Carolina Coalition on Aging and some other resources. You've heard me mention a few times the Older Americans Act. And the Older Americans Act is the financial structure through which federal dollars come down, trickle down to the states and beyond. And, those federal dollars are our dollars too. They all go up and they come back down. So this just kind of gives you some insights into the structure of how this works. The Older American Act talks about the aging network, and this is the sort of the structure where we have a federal administration on aging where these dollars are initially allocated, that every state has a state administration on aging in some form or another. And then from there, it goes down to regional area offices or area agencies on aging. And these agencies typically serve about 10 counties or so. It's different state to state because of population and other factors, but they kind of oversee a number of counties. And then from there, that money goes down to county offices on aging and other organizations that serve older adults. And so you might be wondering, what are some of the things that are funded by the Aging Network? And some of those examples are things like the long-term care ombudsman, people that are making sure that older adults that are living in facilities are getting the needs met that they have and not being taken advantage of. Congregate and home delivered meals. Home delivered meals, Meals on Wheels, very famous, probably one of the most famous aging services around. Also things like transportation, that's really important. Older adults have specific transportation needs that cannot always be met by our existing transportation infrastructure, which already doesn't meet a lot of our needs, unfortunately, but hopefully that will get better. Caregiving services, helping families with that. There's so many benefits to be enrolled in with Medicare and other things, making sure people are getting what they can out of those things, and also housing. So these are just some of what the Older Americans Act funds. And so the North Carolina Coalition on Aging, among other groups, really are thinking about how do we bring all of our expertise and all these different needs together. And one of the ways that they've been doing that is through the multi-sector plan for aging. And you can see a snapshot of that here. trying to support older adults and their families, creating more home-based services. Older adults want to live at home, want to age at home as much as possible, and that actually is oftentimes more affordable for the taxpayer, so it really works out in that way. But doing things like adult protective services, it helps strengthen communities, getting people the services that they need. Thinking about the workforce under optimizing health and well-being. There are a lot of programs that exist that help older adults get paid to get new skills and to volunteer in their communities. And so these have different names depending on what community you're in. But things like foster grandparents is one very famous example of that. And trying to find ways to make aging affordable, because we all know that it can be very expensive with the different needs. And an organization that I just want to spotlight, if you're wanting to look more into an agency that's doing work really well around aging services, I would encourage you to look at the Orange County Department on Aging, and they're based here in Chapel Hill. And Janice Tyler and her team, they do an unbelievable job and really are leading the way in many cases around the needs of older adults. So I have some information in the slides to help you find some of these things, including the multi-sector plan. But you're also all librarians. I know you can find information with just a little bit of information here. So some of that might be helpful. Also, there's a website called the Elder Care Locator. And so no matter where you are in North Carolina or around the country, you can put in your zip code and see what sort of aging services exist around you. And so I grew up in High Point and Greensboro here in North Carolina. So I was doing some searching around here, and I found this example of one agency that would be very helpful. And looking at the services that they provide, it's pretty clear that they are an Office on Aging. They receive some federal money to provide these services. Diversity in aging, as I mentioned before, older adults, like any other group, is a very diverse group. And we need to consider some of those different needs. And so here in North Carolina, I tried to find some North Carolina-based resources, and I really struggled for the most part. They may be out there around some of these different diverse points, but the one I did find was the Carolina Aging Alliance, which serves LGBT North Carolinians who are aging, and they are based out of the Triad and the Triangle. And here are some other websites that might also be of interest to folks. And I kind of want to just show here really quickly some of these demographic snapshots. North Carolina ranks 9th in the population of those 65 and older. We're going to see this population grow, and there's a lot of great statistics that are here from the North Carolina Coalition on Aging, and you'll be able to see in these slide notes. And also, got to point out some of those key references, and I talked about some other resources throughout. And as I come to my last minute here, I just want to say thank you again for coming, on today and talking and spending your time. And I look forward to talking with you more. And I want to encourage you, if you are interested in getting involved, here is a link. You can use your phone's camera to get the QR code, or you can just follow the link, or you can get it from the slides. But this will take you to the survey about the Elder Justice Task Force that we created just about a month ago, actually, out of the American Library Association. So if you are interested in getting more involved or just learning more specifically about what we're doing, would love to talk to you more about that and give you some more information. But thank you all so much for all the work that you do every day to serve patrons in North Carolina, older adults, and everyone else. And I really appreciate all that you do, and I'm looking forward to talking to you more about this. We'll stop there.
Joseph, thank you so much. We have 2 questions that came in through the chat. Our first question is, I have a question about language. If I wanted to do purposeful programming, what is the most well-received term for this group? Aging, older adults, seniors, elderly, and is the age group 65 plus? Just trying to figure out how to attract the right audience and be respectful.
Yes, and thank you very much for that. Let's see. I think I would say, first, you asked a really good question. What is the right language? And this is something that we are actually still really working through. There's been a lot of studies that have shown especially baby boomers, do not like some of the terms that have historically been used for older adults. Things like senior citizens are becoming less popular. And that's not universally true, of course, but that does show in the statistics. So a very common term that I use is older adult. Elderly is typically not used as much. Sometimes the term elder is used with the idea of it conveying respect and recognizing wisdom that older people might have. But the reality is that there's not really a one term that is agreed upon. When we were coming up with the name for the Elder Justice Task Force, we got some pushback on using the word elder, and for some fair reasons. But there are a lot of institutions out there that use the term elder justice, so we thought it was important to align with that. But terms like older adult are very common, and there might be others too. I think this language will continue to evolve, but and typically stay away from like geriatric. People don't like that. Increasingly, senior citizen, people don't like that as much. Elderly definitely is one that people don't like as much. Also, and as far as the age group, it depends. Like it can depend. I typically say in general, it's 65 and older, but in a lot of my research, sometimes I do 50 and older because there are not always resources for people that are in that middle area, and they are kind of the next generation of older adults. So sometimes I include them. If you go and see what your local Office on Aging has, sometimes they use 50 or 55 or 60 or 65. So it really can depend community to community.
We have another question asking like, can you see how the funds are distributed from a national to like a state and local level?
Definitely to some extent. I honestly haven't looked at it like too glacially or granularly to kind of look at it too closely. But I do know, like having worked at the Office on Aging, we get it. One of the things that we used to do is that we would put out a chart of here's the amount of the percentage that we get from the federal government, the state government, so and other nonprofits and foundations and things and private donations and all of that. So that's something, if you contact your local Office on Aging or area agency, they probably can help you find the best resource on that. But yeah, certainly in the federal budgets and things, you can see some detail of, overarching and kind of how that breaks down, but it might not get as granular as you would like, but there are other ways. And talking with the Office on Aging near you would probably be the easiest way to get that.
Gotcha. We have, let's see here. We have one question. I arrived late, so you may have mentioned this and I missed it, but do you have specific advice for serving elder patrons within an academic library?
Yes, so I did in my the sort of the first. Well, it's in the slides, but the kind of the first part I did was specifically on the academic library experience. But yeah, I think it really is kind of, it can be different library to library, but you certainly are serving older adults in the sense that some of your students would fit that category depending on how you define it. Some of the workers would fit that. Some of just the community members who come in use the space. And so I think a really good starting point can let's say that you want to do more work in the academic library. If there's a land grant mission or something, you want to serve more older adults, you could talk with your administration first and kind of look how they feel about it. Or if they're more comfortable with you talking, you could do an informal survey talking with you could approach people in the library or put out information in there and say, hey, if you meet this age group, we would love to get your insights on how the library could serve you better. And some of the literature is mixed, where some studies have shown that older adults feel that all of their needs are met by just the broader services, and sometimes they don't. So it can depend community to community. But it's always great to ask and to do more engagement in that way, and just showcasing all the wonderful resources that you have as an academic library and thinking about how that can benefit the older adult population in your community. I would imagine there's a great deal there.
We have another question. Did you find that in your research, aging patrons from a specific marginalized group had certain needs? Would you be able to share what those needs were?
Yeah, so let's talk about the example of the LGBT older adults, because there are other examples, but that's the one that I know the best from my research. Um, there is this idea, right, that sometimes I think that we as providers, librarians, aging services take for granted, quote unquote, we serve everybody. But some groups historically have not been part of that everybody. So it's not always clear to them that even in 2024 that they are part of the folks that can get services. They don't always feel comfortable asking for services. They don't always even think to look for services, to go to an office on aging because it's so, or a library, because it's so outside of their experience and what they have learned to do to survive. So when we were talking about when I was doing some of the research with LGBT older adults, there were a lot of people that said, I never heard of the Office on Aging, even though I'm in my 60s. None of my friends have talked about it. I've never engaged with it. And a lot of that has to do with in my humble opinion and just sort of looking at things, has to do with not being part of their social network, not having seen how it's been there. So that's like a kind of a big picture example, not knowing how they fit in. One of the things that they said is a lot of them said that my participants said they were very happy to participate in the general services, to go to the senior center and those sorts of things. But they wanted to make sure that people were going to be culturally competent and comfortable working with LGBT older adults. They didn't want to go to the library or go to the senior center and feel like they're othered. So that cultural competency piece is really important for a lot of these groups. And I just think we have to do more than just say we serve everyone. We have to really make a clear attempt to do that, put out the word in areas like if there are publications that serve a specific population, to the extent that we can, putting advertisements about the library in those sort of spaces. Those sorts of things are ways that can be really helpful.
So kind of suggesting like meet people where they are in other public spaces in the
Absolutely.
community.
Yeah. Yeah, that was something like the provider said the LGBT older adults said they really would like to see providers come to the Pride, for instance, and seeing them there at Pride events. And that kind of shows like, okay, these folks are making an effort to serve us, and to be in our spaces. And that's really important for, people with disabilities, immigrant groups, veterans, a lot of different identities. I think sometimes we think that only certain groups have identities, when in reality we all do, and there's a lot of different identity groups that we can do, to the extent that we have resources that we can engage with and should.
Thank you so much, Joseph. Folks,
I
any
just
other questions?
I just wanted to say I've been reading some of the conversation that people are having about the different resources that they're already doing, which is fantastic, and I'm so glad to hear that that's going on, and not at all surprised because I know librarians are folks who are doing the work constantly. If you want something done right, contact a librarian, and just really trying to make things better. And that's why I was so drawn to this field, just trying to help people and trying to make a difference. And I know that you all are doing that. So there's a lot of um, great ideas here with the memory kits and some of the other programming things that are going on. I love the Books on Wheels project. I think that's wonderful. And anything we can do to do more and engage volunteers, like I said before, we can't do it all. We can't fix every problem. We're all, each and every one of us is only one person, right? There's only so much that we can do on our own, but you're already doing a lot in your institutions, and I thank you for that. And happy to talk with you more if you have more questions down the road, if I can connect you with more resources. Since we don't seem to have too many other questions, maybe I can plug a little bit, talk about the Elder Justice Task Force a little bit more about what we are doing. One of the things is we're really looking to challenge ALA. So at the last American Library Association conference, I was the only presentation who did anything on aging. But that wasn't because people didn't try to. So we have to recognize that we need more inclusive aging in these conferences. Um, but also, one of the things we're trying to do is showcase resources. There are so many great resources out there, but if you don't know they exist, you can't engage with them. So on our Elder Justice Task Force website, we're beginning to collect some of those resources for folks. and we are going to be doing training down the road, different webinars and things. And we also are going to be creating a small grant program for students, just writing a short essay on why they want to work with older adults, and it's a $100 prize. So we're not going to ask them, it's like a one-page sort of thing. It's not something we're not going to ask them to write a book on. But we feel it's very important to engage students in this work because they are the future of librarianship. And too often we've seen that they don't, in their programs, for a variety of reasons, don't think about the needs, don't see the needs of older adults. But when they do, they're more interested in meeting those needs. So we need to try to do more of that. And that's part of what we're trying to do with the IMLS project around the training that we're creating.
And with that task force, do folks need to be members of ALA to receive updates or be a part of that?
Well, not necessarily to receive updates, but how it works at this point is the model is that you do have to be a member of ALA and the Social Responsibilities Roundtable, which does have some cost. The Social Responsibilities Roundtable is one of the cheapest roundtables within the organization, but we are also thinking about that, about the accessibility and how can we, maybe that doesn't need to be something that we need to do. We're kind of figuring out the rules as we put this together. We've had one person who's been very involved so far who can't afford to pay, and I've said we'll figure out some way. We want people who are passionate to be involved in this work. So if that is like the only barrier that you might see to being involved, know that we are thinking about that, and we want to have people involved regardless. And one other thing I want to say on that, for each of the goals, we have 4 main goals of the work that we're doing. We have 4 committees. So everyone who is part of the task force has a little job, but we set it up in such a way that no one should feel like overwhelmed. We want everyone to have skin in the game, but we don't want this to fall on any one person. That's not right, and that's not going to be what's most beneficial for that. Okay, I see a question here about the map that you shared earlier about counties and people. Yeah, where can I find details? Yeah, so that was from the North Carolina Medicine Journal. And when these slides go out tomorrow, there also will be a link to it.
All right, folks. Well, you know how to get in contact with Joseph. You will receive a follow-up email with these slides, a recording, a feedback survey. If you would like to see more webinars covering this topic, please let me know if there are specific webinar topics for programming and services that you'd like to see or underserved populations. I know that we have this month-long webinar series where you will have all the recordings available to you. But if you'd like to see more of this covered throughout the calendar year, please let me know. And I would also encourage you, if you would like to present on some of the outreach that you do for aging populations, consider submitting to our annual conference. That call for proposals will come out in early 2025. But that is another great way to get involved on the statewide level. Thank you all so much and have a great rest of your Wednesday. Take care, everyone.